There were two oral abstracts that were presented at the ASCO meeting pertaining to smoldering myeloma. One was a large retrospective analysis done under the International Myeloma Working Group umbrella on trying to stratify smoldering myeloma patients into low, intermediate, and high risk based on biologic as well as clinical data. This is something that we struggle with as clinicians all the time. We worry about just looking at a snapshot and not the whole dynamics of what's happening to the smoldering myeloma patient. What this particular study kind of resulted in was a new definition for high risk based off of having either 20% or more plasma cell percentage on the bone marrow biopsy, having an involved to uninvolved light chain ratio of 20 or more, and 2 grams or more of M protein as the 3 risk factors, and stratified patients based on that. So it's popularly being called 2220 classification. And my concern with this classification is, again, we are not incorporating biologic information. We're not incorporating other potential biomarkers that may be helping us identify patients in a more dynamic fashion. But that's the best that we've got right now. The other abstract was the ECOG study that compared lenalidomide to observation in intermediate and high-risk smoldering myeloma patients, and it read out positively in favor of improving risk of progression to active myeloma, as well as obviously responses, because the observation arm did not get any treatment. I think there were a lot of critiques made about this particular study, the study design, how long it took to accrue, and where we are with the state of science in smoldering myeloma. So at the time the study was designed, it was a very interesting concept, and I think it does prove that particular concept. Will it make us change our clinical practice tomorrow? Probably not, but we will have these discussions with our high-risk smoldering myeloma patients about potential treatments. It will also help us in channeling patients to clinical trials, where everyone is getting something, and that is where the field is headed.